to myself or any one of your other wellness managers. Now, as we do go along, the session is going to be recorded, so I'll just record that now. So if you did want to follow up, feel free to do that at any point in time, and you can refer back to this presentation. So today we have our expert, which is Dr. Balazs Hodasi. I may have said it incorrectly, okay. But he's a Swedish board certified consultant. He's a dermatologist, so he's a specialist in this field. So he has lots more extensive knowledge to talk about this topic, and we'll be able to answer all your questions towards the end also. He's based at King's College Hospital. Okay, so following this, if you do want to reach out to him, of course, you are welcome to do so. So without further ado, without taking any more time, I'll pass it over to you. Thank you so much, Doctor.
Thank you very much. Thank you very much for inviting me. Do you hear me well?
Yes, it's perfect.
Great. Yes, so thanks for the introduction. My name is Balázs Hodasi. I was born in Hungary, but I was living 15 years in Sweden. I started work as a dermatologist as resident 99. So this is my 25th year within the dermatology profession, and I moved to the UAE 2019, and I'm right now with King's here at the Marina Aesthetics Clinic. I do a lot of work with sun-related issues. This is a huge part of our job as dermatologists. So I've been asked to try to summarize all the consequences of the sun and the skin, all related issues. So I tried my best. If there would be any question, actually I have had some of these lectures, and my experience that there's usually a lot of questions at the end. So we are going to have about 15 minutes, I think, for these questions. Yes, this is how the sun radiates to the Earth, and this is all the radiation which Earth gets. The UVC is filtrated by the ozone layer. Thanks God, this is nothing what we are having. This is very highly damages the skin or anything. The UVB, the UVA, this is what we are having in high dose. We do have the visible light that does not really matters much for us. There are rare skin diseases when it causes any trouble. And the infrared actually is the heat, which can cause changes in our skin. So we do start with the heat part because that's the shorter, the infrared radiation, the heat. Usually during summer in countries where they do have a difference between the summer and the winter temperature, when the weather switches, a lot of people comes to the dermatologist office with pimples or pimplish problems. What is happening in these hot countries like Dubai, that our skin, that's the natural way of the skin to protect itself from the sun. We are producing more wax actually. So the skin turns into oily skin. So it's a very typical story here in Dubai, somebody moving to the country and sees just more acne, more pimples. This is because of this. It has actually this name, acne tropica. What usually we do recommend is to change the regular skin products our clients, patients, what they are using, and go for the products produced for the oily skin. This is the best first step in this case. This happens generally to everybody. So during these humid, hot summers in the UAE, we do have much more oily skin. But this is not the big issue. The big issue is actually the UVA. and the UVB, the UV radiation, how they reaching the skin, the surface of the earth, and they're causing long-term changes in our skin. If we want to summarize, the UVA, which is responsible for the premature aging of the skin and actually for the tan, the brown skin color. So usually if you go to a tanning bed, UVA, you are going to get UVA radiation. UVB is more likely to cause quick damage and inflammation in the skin. So if you are having sunburns, usually it's caused by the UVB part of it. If you ask a dermatologist, and this is something I do get this question a lot, what is the safe way to tan? Officially, from my professional position, I have to tell you there's no safe way to tan. All tanning is damage to the skin, because if you do go out to the sun and you are getting UV radiation, the consequences will happen to everyone. It depends on your skin type, what kind of consequences you are going to get. But the sunburn, the aging of the skin, and the skin cancers actually can happen to everyone with all skin types. What is happening, what the UV causes, is something called mutation, and this is, I think this word is very well known nowadays from the Marvel films, but mutation is something which is living with everybody every day here in Dubai. If you are walking out, the UV radiation hits the cells of the skin and changes the DNA. And these small fragments of DNA causes all the changes in the skin caused by the sun, the small damages, the pigmentation, and even the skin structure changes. I'm going to show some pictures how. This is called photoaging. So right now we are not talking about any cancers. This is how the UV causes the skin look mature or aged. This picture was published in the New England Journal of Medicine. This is my favorite picture about photoaging. Here you see a truck driver who was sitting in the seat of the lorry or the truck for 30 years. And this side was out, the side on the sunny side, and this was the shady side. And you see a tremendous, huge difference between these two sides. What is most visible is these very deep wrinkles, but you can also see that the skin structure is changed on this side. It's more laxity, more sagging, and you even see some discoloration of pigmentation. This is what the UV does with the skin in long term. The early photoaging, usually what you see is whitish patches. You can see very fine wrinkles and these spider veins, larger vessels out on the surface of the skin. And you can even start to lose the color and the fullness of your lips. The chronic sun damage, on the other hand, is much more expressed, usually the same lesions, but much bigger, larger. You see them way better. At the end, you start to get precancerous lesions called actinic keratosis. I'm going to show those ones, and skin cancer. So and it actually affects all skin types, all skin colors. Here you see someone with a darker colored skin with these patches and discolorations. These elderly Caucasian ladies are having these wrinkles, the hyperpigmentations, and even these red small lesions called actinic keratosis, which are precancerous. This is very typical, these are very typical lesions on the back of the neck. These were prescribed first at people working outside, fishermen, or people working out on the fields, not protecting their neck. They're getting extremely deep wrinkles because of the sun. The elastic fibers are growing here, and the wrinkles are just going to be very deep. And these red small spots already precancerous lesions. This lesion is called lentigo. This is something we do see very a lot after an age and spending outside time on the sun. Most of them are harmless, but there are some types which can cause trouble later on as cancers. And these are the veins I was talking about. These usually situated on the face or in the cleavage area at most of the Caucasian females are getting these. With this type of photoaging, actually, there are some home remedies you could do. The prevention is the best to avoid the sun and use sunscreens, but you can use antioxidants, for example, to prevent these mutations. Daily vitamin C serum, for example, or retinoids, also protecting you from these lesions. At least the process will be much slower if you use this. If you already have photoaging on your skin, there are a lot of ways to treat these ones. The whole cosmetology or aesthetic is based on to treat the wrinkles, the spots. We do have different lasers, for example, Revlight or Photona, which we could use to remove these dark dots. We have IPL lasers or even Photona, which we can use to remove these veins on the face, on the cleavage area, and the wrinkles could be, the Botox is the ultimate way to start as prevention, and we can augment the face with volume, with fillers. We do have the threads to reduce these wrinkles. Plastic surgeons can do facelift. The precancerous lesions could be treated by different medical ways. There are medications, creams, and small surgical procedures to remove those. Yes. And now we are on to the skin cancers. What we know is melanoma is the most dangerous one. In the whole world, WHO tells that it's about 3 million deaths per year for the humanity, which is kind of a huge number of deaths. So 3 million people are dying every year because of melanoma. And the other thing we need to know is the most usual cancer form in the world is the basal cell carcinoma. So that kind of skin cancer is the most seen cancer between all of the cancers. This is just for a bit of an interesting picture, at least it is interesting for me. So there are three major types of skin cancers: the basal cell, the squamous cell, and the melanoma. And the melanoma is coming from these pigment cells here in the upper part of the skin. The basal cell is coming from these cells. These are called the basal cell. This lower part of the upper part, and the squamous cell carcinoma is coming from here somewhere, the upper part, the upper part of the skin. And What causes this? We were talking about the UV radiation. This is usually coming from the sun, but we do see that indoor tanning in countries where they do not have enough sunlight, people like to get tanned with different skin types, or just want to have this feeling. I've been working actually in Sweden for a while, and yes, it can be really deprimating during the winter time. You don't get actually see the sun. There are months when you don't actually see, you see zero sunlight for 2 months. So I totally buy this concept that if you are going to an indoor tanning, it will give you some plus on the mental side. On the other hand, it increases the risk of skin cancer extremely. As we see that 24.5% the indoor tanning increase the risk developing basal cell cancer by 25%. Who are in danger? People mostly who are having lighter skin tone, people who are having blonde hair, red hair, freckles, and blue eyes. They have to be checked more regularly. That means actually that they are more sensitive for all the sun's radiation, and people who burns easily and tans rarely. People who have sunburns as child. As I remember when I was a kid, we were playing outside and nobody cared. Nobody actually heard about sunscreens at all in the early 80s when I was 6, 7, 8, 10. We were outside without any factor, or every summer when the school ended up, our summer started, we were burning ourselves several times, then we got our tan, and then it wasn't so bad after all, but I usually burn myself. And these sunburns actually increase the risk of malignant melanoma, which is the deadliest skin cancer. Nobody wants to get that. People who are living in the sunny areas, and it could be up high in the hills, or actually we are living in a country where we have more intense sun light, and if you are going out without protection or covering clothing, you are in a bigger danger. People who have a history of skin cancer, if your mom, dad, your grandparents had skin cancer, or yourself had faced any kind of skin cancer, you have increased risk. It means that you need to check your skin more regularly and perhaps see a dermatologist regularly to be sure on the safe side. People having different skin diseases, different diseases, who are having weakened immune system nowadays. There's a lot of treatments for autoimmune diseases, or people having different kind of cancers, which those treatments reduces the activity of the patient's immune system, and that can lead to easier cancer formation on the skin. So these people and organ transplants should actually monitored regularly by dermatologists. This is a medical necessity, and they're really coming to us, and we go through these mole mapping and all this cancer screening, which is actually just a pure assessment of the skin, and we do use for the assessment of the skin and the cancers this tool. It's called dermatoscope. It's a small microscope. We attach it to the skin and check all the small lesions, pigmented, non-pigmented, everything, all the lumps on the skin can be investigated by this. Occupations, there are some occupations which means increased risk for skin cancer, mostly people who are working outside, and you can remember the picture of this lorry driver I showed you previously. Let's talk a little bit more in details about the different types of skin cancer. This is the most common form, not only skin cancer, but between all the cancers. This is the most common form of cancer. Actually, to be honest, I really doubt that it's a cancer because it's not deadly. It was deadly previously when people could not get treatment for example, in the 19th century. But nowadays, it's very easy, straightforward, small procedures, small operations. This is a cancer form which never spreads in your body, never causes any metastasis. You never get any serious disease. The only thing what happens that it grows slowly, slowly. It can have really a lot of different forms. I'm going to show you pictures. This is the most usual form, what you see here. These reddish lump with small vessels outside, and usually it has a bit pearly kind of color on the surface, or sometimes it has this annular on the side elevated form. Usually it's flesh or pink colored and has this pearly shiny surface. Sometimes it looks like a small wound or a dent in the skin. Even you can miss it with a pimple. Sometimes they appear like small scars with a dry surface. These are a bit more difficult to diagnose with this skin microscope I was showing to you. These types, this really looks like a small pimple, and sometimes with bare eyes we cannot really tell the diagnosis. That's why we need this small microscope. This is very typical at the edge of the eye, or the small grouped, looks like small pearls in a group. These are also very, very typical, and these could be treated most of the cases with freezing with liquid nitrogen. So most of the cases don't even need operation. We just destruct these structures with liquid nitrogen, and the healing is very nice most of the time. These are the most trickiest basal cell cancers because they remind us to pigment lesions, melanoma. In these cases, almost always we need to take some small biopsy before we decide how to deal with the situation. But most of the cases, basal cell carcinoma could be removed with a small operation if the patient is showing up in time. It could be treated, well treated, and most of the cases, the patients that do not suffer any long-term consequences from this. The second one is called squamous cell carcinoma. If you read our clever books, the books are telling that this is something which for every 10 basal cell cancers, I should find one squamous cell cancer. That's really not the case. I think it's a bit more rare, actually. This is almost always coming on the sun-exposed sites, mostly on the ears or the face, sometimes on the hands. And in most cases, this really reminds to a wart, like a viral wart. This is a picture on the face. They can show these dry, like a small plaque in the skin, like an eczema plaque. They can remind to eczema too. This is very typical lesion. I've seen very huge one of these, like a wart, and this is just a lump on the skin. These squamous cell cancer types are a bit more dangerous than basal cell cancers. Rarely, if they're sitting near to the mouth area or onto the lips, sometimes they spread inside and causing metastasis, but most of the cases they don't. If the patients are coming in time, we just remove them surgically, and most of the cases is just cured that way. Usually no any aftermath or any other treatments needed after that. Melanoma, this is the most feared one. Nobody would like to get this diagnosed. To be honest, last month here in my clinic, I did remove all three types. So I've seen basal cell cancer, squamous cell cancer, and even melanoma. So these lesions are here with us. This is the most serious one, and this, yes, this is deadly. So these are looking like pigmented lesions, like moles. Everyone can get them. So even I was telling you that people who are having fair skin, people who are having more sensitive skin, they have a bigger chance, yes. But people of color with dark skin, they have also the chance to get melanoma. And in their case, it's even more difficult to get to the right diagnosis. The most famous melanoma cancer patient was Bob Marley, actually, with colored skin, who just did not accept the traditional medical treatment, the operation, and he treated himself with weed, which did not really work out on long term. The signs of melanoma, I just try to summarize this. You should see a doctor if you have any kind of a changing mole. These freckles or mole or age spots that differentiate from the others on the skin. Usually there's an ugly duck rule. We try to pick that one which is not similar to all the others. If they have a different border, the color is changing, they're growing. These are usually the most important things. The melanoma, they can sit on the nails too. That's a bit more rare, but we do see those kind of lesions too. So we have, for melanomas, we use an ABCD rule, which means if you have a lesion which is asymmetrical, one half is not like the other one, or the border is somehow irregular. It's not an evenly shaped border here. It's just all these zigzags here. If the color is changed and you see different colors, several colors, or the color is very dark, if the diameter is larger than 6 millimeter, this 6 millimeter, this is always changing. When I started to work as a dermatologist, I remember it was 15 millimeter and then it went down to 10. Now it's 6 millimeter. So the lesion is greater than 6 millimeter in size and evolving. It means that if it looks different from the rest of the changing, if it's growing, so all are the signs that it could be a dangerous lesion, what you are having on your skin. I show some pictures of melanomas and they can really look like kind of normal skin lesions, what we do see every day on our parents or on anybody outside on the beach. These darkish, irregular lesions. It can sometimes even do not contain pigmentation. So it could be pink or red, which can really cause us headaches. This is very typical one. This actually, I would go to anyone on the street or on the beach if somebody would show up with a lesion like this. This is a homogeneous black one. It's a bit more difficult to just diagnose. And these are lesions on colored people, which is more difficult to see. Usually they do have something called acral melanoma. It means that their melanoma is usually rising on the feet or on the hands. This is a nail melanoma growing from here down there. So if somebody is having a suddenly onset of this pigmented line on the nails, you should see a dermatologist. And yes, if any new pigmentation appears on the soles or palms, it should be seen also by a dermatologist. There are things you can do yourself too. This is what we recommend to patients with history of melanoma or history of skin cancer in the family. Do self checkups. You can check yourself in the mirror. You can check your whole body. And since we do have these extremely good cameras in our phones, I usually recommend my patients to take pictures. It's much easier to compare after some months one melanoma, if it's changing or not. We do take a lot of pictures here in our office too. Yes, the best way is to detect these ones actually is to perform these self-examinations and actually come and see a dermatologist if you are in any kind of a risk zone or danger zone, or if you just get any lesion which has changed and you just want to be sure that you don't have anything on your skin. And besides checking up, there's a lot of things you can do to prevent these, or yes, or just to prevent UV radiation reaching your skin. It's a huge deal later on. You can prevent the aging of the skin, and you can prevent the skin cancers. So if you are outside and you use protective clothing, you use sunscreen, and try to be on the shade, that's the way to deal with it. The American Academy of Dermatology recommends at least 30 SPF. Here in Dubai, I do recommend 50, to be honest. I think the sun protecting factor shows how much time you can spend outside without burning up. So it means that if you are outside without any sun protection and you burn up after 20 minutes, then if you're applying a 30 factors SPF, it means that 20 times 30. So you can spend outside 600 minutes to get to the same result. But these sunscreens, they are not stable if you are outside or you are having a day outside with your kids at the pool or at the seaside here in Dubai. I always recommend to reapply the sunscreen after 2 hours. Do not use tanning beds. They do really harm the skin. They cause you premature aging, and they give you skin cancers. Actually, I think that tanning beds, like smoking in most countries in public places, they should be banned because they lead to cancer. Yes, I do hear this question a lot about the vitamin D. How do I get my vitamin D if I do sit in the shade or if I just not going out to the sun? A very small amount of sunshine should be enough for our body to produce the vitamin D. But also you can eat and take all these supplements with vitamin D. If you don't have enough vitamin D, you are going to get problem with your bones. So you should have vitamin D. That's totally part of a healthy life. There are a lot of food, eggs, liver, and a lot of fish that contains vitamin D. Even dairy products contains vitamin D. So if you just eat those, you can get high levels. But here in Dubai, a lot of people taking vitamin D supplements. Even my family at home, my kids are taking vitamin D. So this is the way to go. It's more safer to take those pills than getting your vitamin D outside on the beach. And at the end, I would like to recommend just a small summer skincare routine. I was talking about this heat and that our skin changes with the summer and it gets more oily. So this is just a skincare routine for the morning and evening and general skincare. So you need some kind of a face wash to remove this oil. I usually do recommend antioxidants, for example, vitamin C on the skin. They can reduce these small injuries, what the UV causes. You should keep yourself and your skin hydrated, so you should use a moisturizer. Wear sunscreen, I've told you 100 times during this presentation, but that's the most important thing. If you moisturize your skin, do not forget the lips and the eye area. Drink a lot of water, that's very important, and do not drink any sugary stuff. Do not drink these sodas, these even aspartame. Last week was published by WHO that can lead to different types of cancer. So all these diet sodas are not really healthy either. So water is the best. Wear breathable clothes which are covering your and protecting your skin, and the sun hat or caps. Those are the best to protect your skin. In the morning, I usually recommend for ladies one face wash for your matching your skin type. Usually during summer, I recommend try to change to a face wash which is more for oily skin. Then you can apply your toner, the vitamin C and the hyaluronic acid. I recommend these ones in the morning. Then you can apply your moisturizer matching your skin type, your sun protecting factor, and then the makeup. If you are outside during the day, you can reapply the SPF as many times as it's needed. And the evening routine, you remove your face makeup with your face wash. You can apply the evening toner for the evening, the retinol, the niacinamide, hyaluronic acid, and the night moisturizer cream. During the day, yes, I told us the SPF you can apply, and there are these face mists, these sprays containing water, hyaluronic acid, very useful. And on a weekly basis, you can do at home skin scrubs, or you can go to actually these clinics to do hydrofacials to remove the dead skin cells, all these kind of treatments. Yes, actually, this was my presentation, and please feel ready to ask me anything. Thank you.
Amazing. Thank you so much for that. Even myself, I found that quite insightful, some great tips for everyone to use along. And so some questions that we had, some questions were asked at the beginning and then you ended up covering towards the end, but I'll still go through them briefly. So the first one that we got was, what is the best time to get vitamin D from sun exposure? I know you mentioned it's better to get it in different kinds of foods, but if someone is aiming to get some from the sun, is there times that are better than others?
Okay, that's a very difficult question because I just mentioned that there's no healthy tan. So if you're asking officially a dermatologist, I will not tell you to go out to the sun to collect vitamin D. The vitamin D is as good if you are taking any supplement. So if you want to go out just for the sake of vitamin D, I would recommend not to do it. But yes, there are recommendations that there are hours in the middle of the day when the sun is way more dangerous and the UV radiation is way more than in the evening or early morning hours. But to be honest, I was down with my dog this morning, 6 o'clock here in Dubai, and I really felt the heat and I really felt that the sun was burning my face. So that's a different question here in Dubai. I think during the summer months and even in the spring and the autumn, the sun is quite aggressive here.
Yeah, so best stick to getting it from different supplements or through your diet. Perfect. Another question that we had, I know you mentioned in terms of the minimum SPF people should be having, but is there a particular sunscreen brand that you recommend?
I have very good experience with La Roche-Posay's brand. It's called Anthelios. Anthelios, they do provide sunscreen for different skin types for kids, and they are broadly investigated before getting out to the market. I was actually working in a clinic at the beginning of my profession, and I was doing some research in sunscreens, and those sunscreen, not all the sunscreen, we were doing testings, and not all the big company sunscreen that time were really reliable, but La Roche-Posay is something which I can recommend.
Amazing. We've got someone else saying that what would be the best treatment done for hyperpigmentation due to not using sunscreen?
Hyperpigmentation, done for hyperpigmentation. It depends on the type of the hyperpigmentation and where the hyperpigmentation is sitting on the skin. We do have a very good peel for hyperpigmentation. It's called Dermamelan. It's good for melasma chloasma, which is a hormone-related and sun-related hyperpigmentation. Other pigmentations due to the sun could be treated with laser. I do a lot of treatment. We have a very good laser called RevRite, which removes these type of pigmentations.
Amazing. And then another question regarding SPF. So you mentioned 30 is the minimum, but in what situations would someone be using 50 plus? And then would there be any scenario in Dubai that they would be using 20? Or as you mentioned, 30 is basically the minimum that you should be using within Dubai, right?
So the minimum I think is 30. So 20 I would not recommend to use even in late afternoon. I know that the reality is the reality. I do not recommend to use 20. So what I can tell you, my family, they're kind of fair-skinned. My wife and my kids, we do use 50.
Okay.
Even in the afternoon.
Yeah, safe. So to be on the safer side, 50 plus is what we should be aiming for.
Yes.
Perfect. And then is it true that you should be applying SPF at least 15 minutes prior before going outside swimming or into the sun? That you should give that time frame for it to settle in?
Yes, usually 20 minutes before stepping outside.
Perfect. And then someone saying, until what time of the day is sun exposure considered safe? So as you mentioned, obviously it's better there's no safe sun exposure, right? We need to be making sure that we're protected with our 50 plus. What is the best skincare procedure to avoid melasma?
Melasma, the best to avoid it, actually to avoid the sun as best as you can, very high factor sunscreen and protecting perhaps a hat with a huge rim. And if you already have melasma, my experience that the best available treatment right now is Dermamelan peeling. if you're having the skin type, you can get this peel. That's the best available product, what we are having today. But there are also laser treatments for melasma, which could help. There are bleaching creams also, which could help.
Someone is saying, so how long can we keep sunscreen on? Can we keep it for the full day? I guess you did cover that. So in terms of
so
what
sunscreen, sorry. So the sunscreens are usually not that stable. So most of the time, what they do recommend is apply the sunscreen and reapply it after 2 hours.
Yeah. Someone has mentioned, what precautions should they take for dry skin people if they're having dry skin during all of the seasons?
Dry skin is very, very easy. Apply moisturizer as many times as you can and try to avoid water contact. I do see a lot of people at my office coming here with itchiness and dry skin. And when I ask how many times do you take a shower, sometimes they do take a shower 2-3 times daily here in Dubai. And I totally get it because you get sweaty, you go to the gym, you want to take a shower, you go to home after work, you want to take a shower again. But this is what makes your skin, makes the skin extremely more itchy. So try to reduce the water contact and use as much moisturizer as you
can. Perfect. Someone has mentioned they do scuba diving every weekend. What is the best sunblock for diving, which is not irritant in the eyes?
Most of the big companies do have now good sunscreens. I usually recommend what I've told, and Helios, La Roche-Posay's products. They have these how they call it. I'm sorry, I just don't remember the word, but they have a very thick for the swimmers, which they can apply. And those are working really well.
Perfect. There's a follow-up question from the hyperpigmentation. They said, how long does that treatment take?
If we are talking about the peel, usually it's for 2 or 3 months, 4 weeks in between, 2-3 occasions, and then every half a year or every year we have to do again, because melasma is a chronic disease. So if you already have it, you're never going to get rid of it 100%. You're going to need some kind of a treatment all the time, and it really depending on how does it look like. So actually, it's kind of an individual approach. Every person is different. Every skin type is different. Every melasma case is a bit different.
Mm-hmm. And are there certain foods or lifestyle habits that could be triggering skin problems?
That's a very, very broad kind of question. If we are talking about right now the sun related issues and skin, usually there no really much food mixed in this whole bunch of problems. So these type of problems, no. But yes, there are some skin problems which could be triggered by different type of foods.
Someone has said, could you provide some recommendations for sun-safe clothing and accessories that can help enhance our sun protection efforts?
If you just bought in the Decathlon, for example, I think that they have the basic sun protecting clothing for swim, for outside, being outside, and they do have kind of normal or acceptable prices. You can start there, but if you go to different branches, the more expensive branches and more expensive products, but Decathlon produces decent quality.
Perfect. Someone has asked if you can go back to the slide regarding the morning routine again. I think they wanted to double check and get a little screenshot of that. Yeah, I think that was the morning routine that you went for. So if anyone missed a little photo of that to implement into your daily routine, there you go. But we will be sharing a recording of this, and also we'll be getting the slides in so that you can have a look back at any of this if you need to. And then there was someone else that mentioned, so in regards to the sunscreen for scuba divers, they personally have said Banana Boat has various options that are reef friendly as well. And I think the word now it's come to my mind as well. Was it zinc that you were thinking of in terms of a thicker sunscreen? No?
It was a type, but I just
Specific type.
I just dropped the word now. So
Okay, no problem. Well, I think that is all of our questions. We had quite a few there in the end, 18 questions in total. Yeah, so we'll be sharing, again, someone's asking about the session. So yes, we'll be sharing all of those details of the session today for everyone to see if they want to look back on. One last question, which should be applied first, sunscreen, then moisturizer / makeup, or should it be the other way around? So I guess what you have here, moisturizer, sunscreen, and then makeup. Is that the correct way to order to put it on?
yes, this is the order. We are on the right slide. Moisturizer, sun protecting factor, and at the end, makeup.
Okay, perfect. Well, if anyone does want to reach out to our amazing doctor here, please feel free to do so. So you're at King College Hospital. You said you're at the Marina location?
Yes.
Yes. Okay, at the Marina location. So if you do have any follow-up, you've come across any of these, you've been needing to look into a little bit further, please feel free to go and book an appointment with him. But if you do any other questions as well, wellness-wise, always feel free to reach out to any one of your wellness clients also. All right, perfect. Well, thank you so much, Doctor. We really appreciate your time and hope you and hope everyone else has a lovely Thursday.
Thank you.
Have a great day, everyone.
Bye.
Recording stopped.